Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today's Thursday, July 23rd. All right, we'll begin with COVID. Let's take a look at the capital region. These are the 8 counties of the capital region and hospitalizations in those hospitals. 40 is the current number. It's a little hard to see on the graph sometimes, but the number to the far right is the number of admissions. Fred, at one point the number was 23.
Right, Dennis. It's gone up over the last week and a half.
If we trace it back, we think that we started to see that number go up right around after the 4th of July.
Right, the incubation period after exposures there.
Now, that number is not as high as it was back at the apex. It's not 200, it's 40, but it is moving up and it continues to move up. And as we've talked about, one of the values in looking at the data on a regular basis is you can see where the trend is. So we're watching this very carefully.
Yes, we are.
Yeah.
We're watching not only that data, but we're also continuing to talk to the other hospitals in the region, sharing a little bit more detail about some of those patients as well.
Okay, so let's dive in here to the medical center. This graph is activity only on our campus. Yesterday, 3 in, 3 out, so about the same. And then if you look at the next graph, which is the morning census here at the medical center, Fred, we currently have 16 in the hospital. It looks like 15 on the floor, 1 in the ICU. I think that person is currently intubated. So numbers that we've seen in the past, we're hovering in that 10 to 20 range.
Yes. So Dennis, that intubated patient today is the first intubated patient we've had the whole month.
Yes.
I think you have to go back to June 28th. So a long time without an intubated patient.
Long time. And that actually reminds me, we have not talked about this in a while, but let me give an update on convalescent plasma. We hit a milestone not that long ago. We've now given it to over 100 people here in the medical center.
Yeah.
And obviously with more antibody testing out there, more people may be aware that they're eligible to be a donor. So it's a good reminder, if you are somebody who would like to donate, contact the Red Cross and others.
And donate, very important.
For sure. All right. Let's stay on the COVID theme for a little bit longer. Fred, we continue to message this, but in point of fact, I don't think we can message it enough. And it's about the things that we can do to try to keep that number as low as possible. And on this campus, we think that we are setting as good an example as we could, and that has to do with masking.
It's very important, Dennis. Masking in the community is something that's very important in preventing spread. And same thing here in the medical center. So we've really done a great job. Our staff has been tremendous in wearing masks, and they need to continue to do that. The community does look to us to set the example, and I think that's important.
Right. It certainly is my sense walking around this campus that over the last couple of weeks, you'd be hard-pressed to find someone who's not wearing it. When that happens, we remind them that that's
right.
Our rule set in any common area. We're expecting people to wear masks.
And the 2 other important issues we shouldn't forget: social distancing
Yes.
and wash your hands, wash your hands, and wash your hands.
And for those who are at the bedside now, wearing of eye protection is incredibly important. And I think we heard today about a significant number of goggles and face shields that have been distributed.
Yes.
So that tells me our workforce is wearing them.
I want to say 3,000 was the number
Yes.
that supply folks talked about. So
Right.
that's great.
The governor normally updates on Tuesdays those states that are part of the travel restriction. And Fred, this week there was more states added to it. So there are now 31 states that if you travel to, you have to quarantine when you come back to New York State.
Yeah.
How does that impact us on this campus here?
Well, Dennis, we continue to ask people who visit, and frankly our employees, about travel. And if they've traveled outside of New York, then we ask them specifically if they've traveled to one of those restricted states. If they have and they're a visitor, we ask them not to come in.
Yeah, it's difficult. I mean, I can speak personally. We go to the Outer Banks every year. For the last 6 years, we've gone with 5 families in our neighborhood. And of course, North Carolina is now on the list.
Yeah.
So we won't be going there this year. So we understand that in some cases it's a personal sacrifice on the part of our staff, but it's important. And if it's going to keep the virus levels down, then that's what I think we're going to do.
You know, Dennis, some of the patients we're seeing
Yes.
with COVID have traveled. We heard about another one today that had traveled to North Carolina. So I think good decision on your part not to go.
For sure. So we'll update again on Tuesday. We'll hope that number in the capital region is under 40, but we'll see what we come up next week.
We're watching it.
This week, the last topic we're going to talk about is nursing, and I think obviously it's a good opportunity to update what the status of our search is. So we are in the process, we've begun, and Fred will give us more details of looking for our next chief nursing officer. So Fred, let's talk about this a couple levels. Let's talk about what our current state is and how nursing leadership is organized on this campus, and let's talk a little bit about the search process going forward.
So Dennis, in terms of leadership on the campus right now, we've done two things. First of all, we've asked Louis Philhauer, who is a nurse, but actually a nurse with a PhD in nursing,
yes.
So Dr. Louis Philhauer, to be the interim CNO. And Louis is very experienced. He's been in the organization 15 years. He's been a CNO in a different organization.
Yeah, even before he came here.
Before he came here, actually two different hospitals.
Two other hospitals, yeah.
He's been a leader in quality for
yes.
us, clinical informatics, and most recently he's the CEO of Benny, which is our demonstration project around Medicaid and DSRIP.
Right.
So he's going to fill in that role. We've also created a Nursing Leadership Council, and that's something I'm going to chair.
Yes.
And all the AVPs and the Director of Nursing of the practice, plus Louis, are going to sit on that council. And we've already started. We meet twice a week. And it's a way for us to deal with issues that arise within nursing and, frankly, deal with them fairly quickly and promptly. The CNO usually reports to me.
Correct.
So ultimately things come to my desk. So me being part of that council sort of fast track some of the decisions that need to be made.
I was going to highlight that. So as hospital system general director, there are various channels that report up to you. Many in the clinical area, Office of Medical Affairs, the physician activities
That's
reports
right.
up to you.
Dr. Posey.
Dr. Posey. Diagnostic and therapeutics, so radiology, pharmacy.
Megan Wigan and Mary Wilkes.
Up to you. Yep. And then nursing has historically always gone up. And so that's
correct.
not different today. You're
Not
just
at
getting
all.
closer to the issue because of the fact that we're looking for
And so we can
CNO.
move things quicker.
Yep.
Absolutely.
Okay. So let's talk about the search. So we've set out a committee, a national search, looking for a chief nursing officer.
That's right, Dennis. We've engaged a national search firm. We've already got the position posted. It was posted last week.
Yes.
We have a very extensive position description that's posted on that website. And we're hoping that by mid-September we'll have applicants to
Yes.
start sorting through. Probably starting interview process towards the end of September, maybe beginning of October. There's going to be a fairly large search committee, which will have representation broadly from
Right.
the organization, nursing, physicians, administration, a whole bunch of folks. That search committee will narrow down the group that we're looking at to probably 3.
Yes.
And then we'll put those 3 through an even more rigorous vetting
Okay.
process. Ultimately making a decision.
All right, well, very good. So we look forward to updates there, and it sounds like the process of including as many people as possible in that selection process is one that's going to
This is
go.
a very important position,
Yeah.
Dennis.
Yeah.
We want to make sure this is the
Yeah.
right person for our organization.
Okay, very good. Finally, 100 and 100. I heard we had some more hires.
Yes. So Sharon Bessel, if you're watching, great job. She has hired 15 nurses in the last 2+ weeks.
Okay.
And also some surgical techs, some transporters, etc.
Right.
So she's really dug in with her nurse managers and is doing a great job. The other group that's working on this, Kate Keefe and Emily Wright, have pulled a list of applications that haven't been acted on. There are hundreds. I believe they actually interviewed
Right.
people yesterday, did some group interviews. They're going to start an every Wednesday group
Oh,
interview
good.
process.
Good.
I'm very confident that the 100 and 100 is going to happen.
All right.
So, thank you.
Thank you indeed. And I don't have a bionic leg. I think my phone was going
Somebody's
off while
looking
we're
for you,
sitting
Dennis.
here. So that's
It's okay.
That's okay. It's part of the job.
You're a popular guy.
Okay, very good. All right, so another warm weekend, so try to stay cool out there. And obviously to our staff who will be working here this weekend, thank you very much. And we'll be back again on Tuesday with some new numbers. Once again, we ask that you please take care of yourself, take care of others, and we'll see you next week.